Looks like some sort of beetle. Oh yeah, these are costumes. Let it go. All right. Hi everyone. Hi everyone. Hey, good.
It's such a good day.
Thank you, Thomas. I said some sarcasm, but I'm gonna hopefully take that as a compliment.
Yes,
Right?
you should.
Rather than
You should take everything common sense and
well, there's some truth to that. All right, folks, it's Monday. You know what that means? It is Med Talk Monday. So let's start with. Well, good. Then I'm doing my job. All righty. So let's do a little Med Talkies. Hopefully there'll be some good ones. Remember last week we left off with, oh, she hasn't posted. Remember, I was hoping there's no rhyme or reason to when she posts these things. Usually Monday is the mystery diagnosis, but it's not necessarily like going to be like Monday by this time. So we'll look at that next week. Let's see this one. Ooh, oh man, that is amazing. So here we go. We'll play this game again. Is it knife? Is it animal? Is it machine? Or is it diabetes?
Diabetes. I'm going with like a
Got sleepy eye. Blepharoplasty is a type of plastic surgery that repairs droopy eyelids, which is usually a result of aging. This surgery consists of removing excess skin, muscle, fat. I didn't see that coming, but there you go. Nice. They get that done. Well, hopefully they put you out there for this. Oh, this is a doozy. Okay. Gastric sleeve leaf test. Okay, so have you ever wondered what how surgeons know their gastric sleeve surgery is successful and it's not leaking? This is how they do it. Okay, so what we've got here is they are pumping that gastric sleeve with a saline solution. They're going to suck up that saline solution there. So this is the stomach. This would be fat on top of the organs in the stomach. Okay, so this person, basically what they did was they removed a piece of their stomach to shrink it as an option for losing weight. So there's lots of different ways to do this, this surgery, but this is the gastric sleeve is one of them. Pretty cool. And I've known several people that have gotten this surgery and it's been successful. Ooh. Oh man. There we go. That's a knife right there in that guy's eyeball. Let's see. Wonder how that happened. Don't pull it. Oh, the gross room. Here's another plea for the gross room. I know I haven't done it. I'm poor right now. Yeah, this is no good. Ouch. Public health nail salons. Nail technicians in the U.S. are licensed. They legally have to have formal education and pass the state board of licensure to work on people. This licensure is set up to educate the technician about the dangers of the chemicals they're working with and the injuries they can accidentally inflict with their tools. With the change of protocol due to the current pandemic, accidents are bound to happen because what has worked in the past is different. This patient is a 10-year-old child. She was in, guys, I can't hear myself, thank you. Okay, she was in quarantine with her family for months, and her mother decided to take her to the nail salon to get them out of the house. This is something they had done many times in the past, but now due to new sanitary guidelines, this time was different. When they arrived to the nail salon, they were met with plexiglass. The stations were sanitized. They were also instructed to sanitize their hands prior to getting work done. The 10-year-old was given a gel manicure, which includes using special polishes that get cured with a UV light. Gel polish should not be applied to children for several reasons, and this nail salon should have never performed it. Within hours of her manicure, her hands were red. It's photo 4. I'll look at this again. And over the course of the next couple of days, they progressed to the burns you see. She was brought to the doctor and diagnosed with second-degree burns. Her doctor thinks the burns occurred because of a combination of hand sanitizer, acetone, UV lights, and counter sanitizer. Her mother did contact the nail salon, who blamed the nail tech for, quote, leaving her under the UV lights too long. This child was severely injured just trying to get her nails painted. Children have more sensitive skin than adults, but this injury could have happened to anyone. Chemical burns are no joke. Pretty crazy. Oof. Really? Oh man, that's horrible. How long did it take to get better? Ooh, gosh, that's crazy. All right. Just for old time's sake, here's this one again. Oh man, that one was just so good last week. All right, here we go. 89-year-old woman presented to the ophthalmology clinic with a 4-month history of redness and sensation of a foreign body in her right eye. Examination of the fundus and evaluation of pupillary response and intraocular pressure showed no abnormalities. Slit lamp examination revealed a red raised lesion on the conjunctiva. You probably heard of conjunctivitis, right? That's also called pink eye, right? Somebody farted in your pillow. Okay. Telangiectasia. Let's see. Lesions. Okay, we'll get to the good stuff. The lesion revealed squamous cell carcinoma in situ. The patient completed 4 weeks of adjuvant therapy with topical mitomycin C. There was no recurrence. That's crazy. So I didn't know you could get that on your eyeball. I'll tell you something later about an eyeball, but you don't have to get there. Oh, that's gross. Yeah. Okay. Yeah. Right. Imagine what her breath smells like. She had a painless ulcer on her palate. Okay. This ulcer had a necrotic base. Let's see. I'll get to good stuff. A diagnosis of extranodal natural killer T cell lymphoma. Nasal type was made. A bone marrow biopsy revealed evidence of hematophagocitosis, which is associated with this disease. Chemotherapy was initiated. However, the patient died 1 month later. So that is crazy. It doesn't say how they got it, but I wish they did, because that's nuts. I've never seen that before. Yuck. All right. Oh, dear heavens. Wow. Corkscrew esophagus. Wow. I've never seen this before either. Okay. This woman had trouble swallowing, chest pain. She had a weight loss of 9 kilograms. She got this esophagram, which is basically like an upper GI. So they stick a camera down your throat. Okay. And this corkscrew pattern was revealed. This person was treated with botulism toxin. Okay. She had no regurgitation. Man, I like this site a lot, but it doesn't tell me how you get this sort of stuff. I guess I'm going to have to look some of that up. So typically your esophagus, so that's the food tube, right? Goes from your mouth to your stomach, and it should be a straight line, right? These are all your cervical vertebrae right here, going into the thoracic vertebra, okay? And so it should not look like this corkscrew. I have no idea how that happened. That's crazy. Oh, this looks nice. Okay, which bone is this? Which bone is that? Okay, which bone is that? That's the leg bone, right? And there's some nice plates. Oh yeah, man. Firework. Oh yeah, I forgot firework. Metal plate. There you go. Coal miner. Coal miner. Oof.
Heavy coal trolley overturned, 30-ton weight fell over his.
Oh man. Not fun.
That's not a good thing.
All right, let's do a couple more of these. Oh, here we go. All right, knife, firework, diabetes. machine. Let's see. Okay, here we go. This can give you choices. And they don't tell you the answer. Let's see. Oh, C is the answer. Large piece of glass. Mugging, wood with axe, attacked by a bear. Nasty fall down the stairs. There you go. Large glass. Man, glass, I'm telling you. Oof, that'll get you. All right, this is going to be gross. Ooh, what happened here? Patient fell at home and suffered this injury. He went a lateral campotomy and cantolysis. Doesn't look like that person's gonna be able to see out of that eye again. Pretty cool. Ooh, whoa, whoa. What is it? I don't know what it is. This is a surgical technique used to secure the areola and prevent stretching in post-operative following breast surgery. So basically, here you go. Even though it doesn't look like this, they've cut the nipple off, right? And that's pulling the skin back in, right? So most likely probably had to remove the breast tissue because of cancer. And last but not least, look at this baby's head, okay? Will my baby's head look like that forever? Okay, so a lot of people get the cone head, and you guys all know that your skull is not fully formed after you have a baby, right? So when Ira was born, I could see the top of his skull, like the top of his head throbbing, like you could see his heartbeat. Okay, that's why you never want to go up to a baby and just go, hey there, little baby, and like press, because you're gonna press right into their brains, right? Not cool, but it's an advantage, right? You know, like so. So imagine what do you think would happen if the baby's skull was fully formed?
His brain would have no way to expand.
Okay, brain would have no way to expand. What else? Okay, I'll tell you something else will most likely happen.
Oh, they get stuck when
They get stuck, and if they get stuck, what could potentially happen?
they die.
Okay, the baby would die, but also who else would die? The mom would die, right? So some think that that's a nice evolutionary advantage. Like even though your brain is not, your skull's not fully formed, you still have a greater chance of survival later on in life. Okay, let's watch a popper. Here we go. Let's see, this one's got to be good, right? Oof.
Oh no.
Neck ones. Oh, it's a waterfall. Oh yeah, did you guys? If you guys have not seen the waterfall ones yet,
Cyst on the neck.
oh yeah, this is going to be a good one.
It's gonna be juicy.
Very juicy. Oh, the waterfall ones always get me. Oh yeah, I've seen ones like this before. There it is. Oh, oh, gross. Oh my God, it's just amazing. Oh yeah, here it comes. There's gonna be more. But wait, there's more. Oh, my
It's like a TV commercial, but wait, there's more.
But wait, there's more. For $19.95, you could get this and more. Okay, good stuff. All right, let's get out our Chromebooks, and we are going to officially have that first practice quiz on Wednesday. Okay. Okay. So again, we will evaluate whether or not you are going to be ready on Wednesday. Also, remember that no matter what, if you get a perfect on Wednesday, you're good to go forever on the tissues. Okay, but let's repeat after me. Nerve? Nerve. Good. Simple squamous. Good. Simple squamous. You should lead it. You ready? Mackenzie, you want to lead it? You were happy on it?
Those are the only two I know.
All right, fibrous cartilage. Fibrous cartilage. Simple columnar. Look at you. Simple columnar. Good. Loose fibrous. Loose fibrous. Stratified columnar. Stratified columnar. Highly cartilage. Highly cartilage. Bone. Bone. Elastic cartilage. Elastic cartilage. Adipose. Adipose. Simple cuboidal. Simple cuboidal. Some people have trouble with that word. Cuboidal. 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 Not B-O-Y-D. There you go. All right. Those these together. Smooth muscle. Smooth muscle. Dense fibrous. Dense fibrous. Same with me, folks. Stratified cuboidal. Stratified cuboidal. Good. Pseudostratified columnar. Pseudostratified columnar. Blood. Blood. Stratified squamous. Stratified squamous. Cardiac muscle. Cardiac muscle. Transitional epithelium. Transitional epithelium. Good. Skeletal muscle. Skeletal muscle. Okay, fantastic. Okay. For you. All right. We'll do live. Visuals. Oh man. Yay. Hi, I've missed you. It's been too long. You good? We're playing a little Quizlet.
Right here is that. There's that 90-yard pickup. No, that's 5 seconds.
All right. There's more than 17 of you in here. Who are we waiting on?
I'm getting
You're getting there?
Why would you just get tested? I don't know. Testing is, I don't know. I think my body's just gotten used to it after a while. It's just, which test do you take?
Nice. Let's do it again. Kate, you're unstoppable. Unstoppable.
It's just something that scares me.
What doesn't scare me? I just refuse because, yeah.
Is Katie Miller not in the league no more?
Choked. Oh man.
At least it's better you choke on course than
I think he said something, I'm not sure what he said.
Nice, nice. One more time.
Why are you trying too hard?
You try hard.
Reminds me of you.
Nice. Came back. All right, now listen up. Okay, and Elena, I'll need you to do this too. Everyone go to Quizlet.com and open up the one that says tissue quiz practice. I will give you participation credits for this. Okay, so everyone gets 10 out of 10 after they show me your score. Let me explain what we're going to do. Okay, and Elena at home, or if anybody else is watching this video, you also need to do this. So you go to Quizlet.com, you open up the tissue quiz practice. It looks like this. Once you're there, you need to click test. Okay, once you're on test, okay, then I want you to click options. Okay, you get me over there? Okay, once you're options, I want you to click multiple choice. Okay, and I want you to do 20 out of 20. Okay, so Elena and anyone else at home, you do this as well, but what I need you to do is screenshot your score and send it to me in an email. Again, everyone will get a 10 out of 10 regardless of your percentage on this, but you create new test. I know this is not exactly multiple choice, 20 out of 20. I want to see what you personally will get, okay, out of doing this, even though I know realistically we're writing these out. I want to try it right now. Okay, so it is tissue quiz practice. You click options. Okay, then multiple choice. Your screen should look like this. Okay, and then create new test, and voila, it will look like this. Okay, don't raise your hands. I will just come around in a second just to see what you got. Again, your score doesn't matter. I will give you 10 out of 10 for participation. Partly one reason I'm doing this is to see how you're doing. The other reason I'm doing this is for my online virtual students to figure out who's watching these videos and who's not watching these videos. Well, you don't have to, man.
Like this, but
So even if I don't get a 20 out of 20, I still get a 10 out of 10.
Yeah, correct. But I need to see your score in here.
Embarrassing.
I will come around, yes.
I'm about to submit this. 65, baby.
I use the mouse.
I'm pretty sure I answered the same for three of them. So I think they're going to do
That's tough.
Yeah, that's tough.
I have a huge stop.
I like seeing 80 to 100. If you're in the 50s, in the 60s,
I'm in the 60s, baby.
okay, I'm a little worried about you.
10 out of 10.
I'm slightly worried about you. If you're in the 50s or 60s, I'm worried about you. Okay?
Why not 65, if you're wondering?
That's not horrible. Okay.
Chase, you got 100? I got 100 too first try.
All right. And Elena, once you're done, if you could just send me a screenshot of that. Send me a screenshot of that. That would be awesome. All right, now go to Google Classroom and open up the document that looks like this. On Friday, we started talking about parts of the bones. And I believe we got down to, we talk about head, linea, meatus. Oh yeah, I was gonna show you my human skull. Hold on a quick second. Let me grab it. Again, I am not sure where these things came from. Oh man. All right. Just later on. Okay, so this is a human real human skull, and hear that little rattling. Okay, so that little rattling. Okay. Let's see. Okay, is what's that? I don't know. Yeah, it makes me wonder. Hold on, I'll get it. Yeah, it's all good. Okay, so this, I have no idea how I got this. It was just in a box. Okay, hi. It was just in a box in my prep room. Okay, but that rattling that you hear is because of so right there is the auditory meatus, external auditory meatus. That's a tube-like thing. And if you look inside this bone here, that's the temporal bone. That temporal bone is a little bit raised. That's because inside that temporal bone are those three bones called the incus, the malleus, and the stapes. Okay? What's going on over here? Okay, great. Yeah. Let's talk about it later. Cool. All right, so that's those three bones. So there's that meatus, there's that little tube. You can see it right there, that little hole, and it goes inside that temporal bone, which is right there. So if you're watching at home, there's the meatus right next to the mastoid process. That's the inside part of that bone. Here's the mandible. Again, it would be fun if you ever become rich someday, you're like, oh, Mr. Ruth, I'll give you a bunch of money to figure out who these people are. We could probably get a little DNA out of this somewhere, I would think. And so we could figure out like the age and stuff, or maybe that's going to be your business someday. Just remember me. That would be awesome. Yeah, I don't know how much it would be just to do it like on my own. You know what I mean? Thousands of dollars probably.
You got it. Really?
I mean, extracting, like getting the DNA is the harder part. You know what I mean? Like trying to get it out of that tooth.
I don't understand.
Well, you not understand. All right. Well, we could talk more about it later. All right. So where we left off was then process. I think we talked about process, right? The process is that prominent projection. So I just talked about the mastoid process. Who else has a process on their bone? Okay. Okay. You don't have a process on yours, I don't think. Right? She's like, oh, I'm just going to stretch, right? Okay. Come on. Who's got process? There's lots of them. Okay. Yeah. What's your process on your bone? You got a acromion process. Hold that up and show everybody. Point to the process. The acromion one. The acromion one is that one, and then the other one is the coracoid process. My favorite is the styloid process. There's a couple of them out there. Who's got a styloid process? All right. Point to your styloid process. Yeah, you have to get your bone. Okay. All right. The styloid process. Did we talk about this on Friday? Okay. I can't remember. Yeah, there's the styloid process. It's like you're writing with a pen, right? Like a stylus. All right. I think we talked about sinuses, right? Did we talk about sinuses?
I haven't done that at all.
We didn't. We did get down to styloid. Okay, so we did talk about the pressure in your head, right? The pressure in your. That's because there's little tiny caves inside your skull, And those little tiny caves inside your skull fill up with liquid, and it's really super gross. All right, now let's talk about a suture, and this is perfect for the suture. Okay, we saw that baby's head, right? So these are the sutures, okay, and you can guess that this one right here would be the frontal or coronal suture, and then this one right here, okay, is a sagittal suture. All of these, when you were born, okay, are not fused, okay? So these sutures, okay, there's a soft spot right here on the baby's head, okay? And if you ever see a baby, okay, you can see there's that little, like, sometimes, I don't know why Iris was throbbing all the time, okay? And Linus's was not, but we could see his little heartbeat right there, like, the top of his skull was just like, that was gross. It freaked me out. I was afraid I was going to like poke it and give him like permanent brain damage, right? Those are sutures, okay? And you find that, of course, in the skull. All right, let's look at trochanter. We only just have a few more.
I have one of those.
Trochanter, show us your trochanter. Okay?
I think there's one up here.
Nope, that's the head.
Right here.
That's the neck.
Right here.
Okay, you're close. Can I touch your bone?
Yep.
This is the greater trochanter, okay? This is the lesser trochanter of the femur, right? Okay, and the definition is a large process, okay? Now, okay, large is trochanter. The next size is a smaller one, which is a tubercle. Who's got a tubercle in here? Who's got a tubercle? Come on, man. You do, right? Yep. Don't you have a greater and lesser tubercle on the humerus? That's all right. The tubercle of the rib is the example in this thing. I did not make the person do. So you, right? Did you find it? Okay. Do we only have one humerus in here? Okay, you've got one. Can you show the greater and lesser tubercles? Yeah, right. Okay, so that's the lesser one. Okay, so notice this big little knob and this little tiny knob right there. There's the big one. There's the small one. Those are not like, can I touch your bone too? Look at the trochanter. The trochanter is huge. Okay, these little tubercles are not as big. So compare trochanter with tubercle. Then we've got one other tiny little small one, and that's the tuberosity. Okay? Where's my tibia? Tibia. Tibia. Who's my tibia? Someone's my tibia? There we go. Gavin. Thanks. Okay, can you show us where the tibial tuberosity is? No, it's right here. Okay, so this little guy right there is the tibial tuberosity. Also, my clavicle. Are you my clavicle? Who's my clavicle? Okay, yeah. That little knob, point to that little knob right there. Yeah, there's that's the longest name out of any of them, I think. That's the tuberosity for the insertion of the corpoclavicular ligament. That's a mouthful.
And I have to know that?
You have to know it and spell it and write it all out. Woo! Woo! You got it. You can do it. All right. So those are my general bone terms. There's lots of people with processes. There's lots of people with tuberosities. There's lots of people with spines as well. Okay, spinous process. And sometimes we combine some of those terms together as well. All right, real quickly, tell me the name of your bone. Okay, what's the name of your bone? What's the name of your bone? Cervical vertebrae.
Patella and the highway.
Okay, good. Good.
Because you don't know it.
Clavicle. Humerus. Femur. Okay, all right, good.
Katie cannot pronounce
Lumbar.
See, that's the one who's C.
Mandible.
Okay, I don't care. I don't use proper English.
It's like, yeah, I seen this really pretty girl, and then I told her, like, oh, I love you, I'm about to go there.
Joe Cavalier.
It's okay, that rejection happens.
All right.
Oh, Asian.
Go ahead and put your phones back. Thank you.
What is he talking about?
Elena, did you have any problems with that? We'll do the tissue quiz, practice quiz on Wednesday. So practice tissue quiz on Wednesday. And thanks for joining me. I missed you a lot. So take care of yourself. Bye.